Do you know what the difference is between all these wrinkle relaxers? Here's a hint. They're actually more similar than you might think. Hello, I'm Dr. Melissa Chiang, board-certified dermatologist, and welcome to my new YouTube channel. In the past, my videos were posted on our main integrated aesthetics account, but my practice has grown, so I wanted to create my own space to focus on the non-surgical side of aesthetics. I find that as I have gotten older, I love this space even more as a way to maintain and take care of my patients, as well as myself. And one of my goals with this channel is to give you insights, using my background as a dermatologist who focuses on aesthetics and beauty. So thank you for being here with me today. Now let's get back to our topic. If you haven't guessed, today we're talking about neuromodulators, or as I like to call them, wrinkle relaxers. Let's start with a quick history lesson. The very first neuromodulator entered the market in 1989 as a treatment for lazy eye and twitching eye. And by 1992, Allergan had acquired Oculinum and rebranded it as Botox. 10 years passed, and Allergan got FDA approval for cosmetic Botox, and this was initially for the frown lines. This was 2002, so it was just before the start of my dermatology residency, and I don't think anyone could have guessed at that time the leaps and bounds that the non-surgical aesthetic industry has taken since then. Since then, we've seen several other brands enter the neuromodulator market. There's Dysport, Xeomin, Daxxify, and most recently Letybo, which entered in 2024. In our practice at Integrated Aesthetics, we offer Botox, Dysport, Xeomin, and Daxxify. Let's first talk about their similarities because I think there's an importance in starting there. They're all botulinum toxin type A. They all share the exact same active molecule. They all work the same way, which is they temporarily block the way that the nerve is able to communicate with the muscle. And this is how they relax wrinkles, by weakening muscles temporarily. That said, there are slight differences which can be important. So I break these into patient considerations and physician considerations. As a patient, you're probably concerned about onset, which is when will my neuromodulator take effect? Duration, which is how long will it last? Cost, and accessibility. Let's start with onset and duration. The important thing for you to know is that there is more variability between one person and another in terms of onset and duration, sometimes than there even is between neuromodulators. So I'm going to give you some general rules. In general, the complete onset takes about 1 to 2 weeks, and the duration is something like 3 or 4 or possibly more months. According to the product labels, which average large numbers of patients, Dysport and Daxxify have the fastest onset. So if you're a procrastinator and you need to be ready within a few days, ask for Dysport or Daxi. Botox takes about 4 to 7 days as a reference. Duration, or the length of time that the treatment lasts, can vary. Some patients are fast metabolizers, and other patients go through it more slowly. Patients generally get 3 to 4 months from their neuromodulator, assuming a standard dose. When Daxi first came onto the market, we actually thought that there might be the possibility of a much longer duration based on their product label, but it seems like it is much more patient to patient in terms of who will get a long-lasting result and who will get a result that's more like a Botox result of 3 to 4 months. This is consistent with an observation that I've made in my own practice. Some patients will get a longer duration from a specific neuromodulator, but for one patient it might be Xeomin that they get that long result from. For another patient it might be Dysport, and for another patient it's Botox. So it can be very patient specific. A question, would you rather have results that kick in faster or that last longer? I'm curious to know what you prefer. Drop your answer in the comments below. I have a feeling that there's going to be a split between the procrastinators and the planners. I'm a planner. Next is cost and accessibility. In our practice, we have decided to price our neuromodulators the same so that an equivalent treatment of Botox will cost you the same as an equivalent treatment of Xeomin or Dysport or Daxi. And the reason why is that we want you to base your decision making on the neuromodulator that works best for you and not based on pricing. The right choice should be about your goals, your timeline, and your comfort level. Accessibility refers to how available the neuromodulator is. There are some practices that only stock 1 or 2 or 3 neuromodulators. The reason why is the more you stock, the more expensive it is to keep your inventory. So as new neuromodulators continue to enter the market, I think we're going to find that not all brands are available in all practices. So if you want a less available neuromodulator, you'll have to look for a place that offers it. Now, there are also physician considerations, and here is where things get really interesting, at least for me. Each brand does have unique characteristics, and sometimes that matters when I'm deciding which neuromodulator will work best for a patient. The characteristic that I probably think the most about is diffusion. Diffusion is how far will the neuromodulator spread from the area where it's injected. Dysport has the largest diffusion, which is something I actually love for treating broad muscles. That diffusion gives Dysport a softer and more global effect. However, sometimes we want our neuromodulator to be able to be very focused, especially in this area right here, or the chin. We don't want spread because what spread can mean is unwanted side effects. So in those places, we have to use a little more caution. And then there is a category where I think the physician and the client considerations overlap, which is resistance. This is something that I'm thinking more about. Resistance is still very uncommon. But as we see more people using it for longer periods of time, there does seem to be a slight uptick in the number of cases. Xeomin has no ingredients other than the active molecule. Remember, we had talked in the beginning that all the neuromodulators share the same active molecule, but the other neuromodulators have additional ingredients. And so there is the possibility, and there are a couple of papers to support this, that with long-term usage, Xeomin may be less likely to cause an immune reaction. And so if you are thinking about using your neuromodulator for decades into the future, and you're really risk averse, you might want to look more into Xeomin versus the other products. We all care about the beauty of the results. I'm curious to know, what is your other most important consideration? Is it onset, longevity, cost? Let me know below. If you are looking for specific results from your neuromodulator, remember these main takeaways. For fast results, say you have a big event coming up, ask for Dysport or Daxxify. If you prefer to use a product with less additives, choose Xeomin. If you want the potential for long-lasting effects, perhaps try starting with Daxi, but you may also want to try the others as well so that you know how your body responds to each particular neuromodulator. If you're looking for a reliable product that's had a lot of testing, a lot of trials, then go with Botox. That's all I have for you today. Thank you so much for watching. But before you go, it would mean a lot to me if you like and subscribe to help me grow this new channel. And I do have one more question for you before you click off this video. Are you Team Botox, Team Dysport, Team Xeomin, or Team Daxxify? Leave your answers below. Thank you again for watching, and I look forward to meeting with you again in the future.